Okay, well, thank you for attending this breakout session of the National Tribal Health Conference. My name is Erin Morris. I'm the Congressional Relations Manager for the National Indian Health Board, and I will be moderating today's session. Today, we are grateful to have an expert panel here from a variety of organizations to present on virtually engaging with Congress during COVID-19 and beyond. This session will last from 2 p.m. to 3 p.m. Eastern. Please be aware that this session is being recorded. All participants have been muted. Please leave yourself on mute unless the presenter specifically asks you to unmute and engage. And please leave questions and any comments you have in the chat box in the Zoom room, and we will make sure to take some time to answer questions at the end of the session. There's also a chat box on this conference website specifically for this session, and attendees and the presenter alike can continue any conversations through the chat box. Additionally, presentations have been put in the file section of the breakout on the conference website page and can be viewed later on. So at this time, I am going to hand it over to our Congressional Relations Director, Rhonda Harjo. Rhonda?
Hi. Good afternoon, everybody. This is Rhonda Harjo. I'm with the National Indian Health Board as the Interim Director of Congressional Relations. I'm Mississippi Choctaw and Muskogee Creek from Oklahoma originally. I was with the Senate Committee on Indian Affairs for 16 years before I retired. And then Stacy Boland, the CEO from the National Indian Health Board, said, come work with us. So I did. And you know, Indian health is so important that I stepped out of retirement to do it. So I'm happy to be back in the mix with all of you and working with the board on this fabulous conference. Today, we have a number of wonderful panelists, as you heard from Erin, and I wanted to take a moment to introduce Erin Morris to everybody, who is the Congressional Relations Manager for the National Indian Health Board. She's worked on the legislative policy field in Washington, D.C. since 2016. Previously, she served in roles that focused on climate change, occupational health and safety, and opiate recovery policy. Previously, she also worked at the National Drug Court Institute in the Training and Research Department. She's a graduate of the University of Missouri, and she was one of the few that worked almost single-handedly during the pandemic for the National Indian Health Board. As you know, that was a tremendous workload, and we certainly are grateful that Erin was here to help shepherd many of the initiatives and the funding and the issues through. So for now, I want to turn it over to Erin to begin our presentation today.
So we will get to everybody's presentation later today, but I also want to recognize our panelists that we have today, including Brian Gunn from Powers Law, Mike Andrews from McGuire Woods, Rachel Joseph from We Win, and then Nicholas Lewis, who is the Vice Chairman of the Board of Directors for the National Indian Health Board. So Congress has three different types of authorities that they administer through one of their responsibilities as one of the three branches of government: oversight of programs and agencies, investigative power, and also the ability to pass legislation into law. Congressional duties, including for the oversight and investigative part, include providing oversight to agencies and how those agencies use federal funds, providing letters to those agencies, conducting hearings and investigations to those agencies for a sense of quality control and also the management of those funds, and then also overseeing the Office of the Inspector General and the Government Accountability Office, issuing the effectiveness of the funds Congress gives to those agencies as well. For the legislative process, I'd like to give a quick overview. The congressional duties for the legislative process include, saying, the introduction of a bill that a member of Congress puts forward in the House and the Senate. And then once that bill has been introduced, it's known that it goes to a hearing of the respective committee that it's related to. So for instance, a lot of tribal health facilities fall under the purview of the House Natural Resources Committee under the Subcommittee of Indigenous Peoples of the United States. Following that hearing is a second type of hearing per se called a markup session if there are any necessary changes to the legislation of text that needs to happen, and then a committee report is issued following that markup. A lot of times bills sometimes do not make it past this part of it, and then a lot of that advocacy comes getting floor consideration for that legislation to go to a vote. A lot of times we see bills stay stagnant beyond that, and so a lot of the advocacy that the National Indian Health Board pulls from and a lot of other advocates pull from is to give reason to Congress to bring that bill to the floor because of the significant policy impacts it would have. Once that bill were to pass, it would either go from the House to the Senate or the Senate to the House, go through the entire process again, and if successful, that bill then goes to the president, who can either veto or sign into law that bill. And that is a very brief overview of just how that process works.
Thanks, Erin.
Have to pay for your medications now.
Okay. Thank you, Erin. I wanted to kind of touch base on oversight and why does it matter? As Erin mentioned, they watch the agencies. Can we mute people? Hi.
Okay.
Don't forget to mute.
Please mute yourself if you're not speaking. Thank you.
Why does it matter? We have to ensure that the policies and programs are carried in a way that is most effective, efficient, and it's proper according to what the law is and what the constituents want. So that is where Congress can be really helpful to tribal communities in some of the agencies that they work with. But how do you begin that process?
But let me see.
Hi, can we mute? Thanks. Okay. But how do we begin? And that's something that our esteemed panelists on the next section is going to talk about in a little bit more detail, as well as some of the best methods of oversight. But typically, some of the things that they do are hearings and working with the OIG and GAO to really do a deep dive into how the agencies are running those programs. Okay, next slide, please. All right, as you start to engage with your congressional members, there's some important things to remember. You need to engage early, especially with those new members of Congress. Introduce yourself, your community, and what's going on in your community, and the issues. Especially make sure that those are addressed and raised with your member before they actually do become a real problem for your community. And when there's an announcement of initiatives, for example, when the new president came in and he outlined his domestic agenda, and there was going to be this bipartisan infrastructure bill, as well as doing some things through budget reconciliation, it was really, really important that Indian country get in on this and you start working with your members, individual members, from the get-go. Before January 20th happened. And that's something that the NHB and the rest of Indian country did very early on, discussing the issues, laying out the issues, explaining, and working with members of Congress to make sure they understood what Indian country needed and wanted. Then, of course, updating throughout the processes, whether it is through a bill process or just throughout the congressional year. It's important that you maintain contact with your member and update them on what's going on with your particular issues. And that's one of the things that our panelist is going to discuss in more detail. Next slide. Okay, the legislative process and the key points of contact. One thing that you're going to hear about later on in the panel, but I just wanted to touch base on this, and you'll be able to review this in more detail. We will have these slides up within 10 or 15 minutes after the session on the website, is to do your homework. When you identify problems, propose solutions, it's just not enough to come up and say we have problems, but let's talk about solutions. And then there's a wide variety of options that the member can think about, either a bill or a letter to an agency, but you have to do your homework and review some reports and audits and so on. Next slide. Okay, this legislative process, as Erin mentioned, there's points that you can contact and work with your member. After the bill's introduced or before it's introduced, you can help draft it, review it, help find co-sponsors. And then they're going to want to know what the agency's view is. And some members, they feel like, well, we want the agency's view. We want to work out the issues before we introduce. Some are okay with introducing it and then working out issues afterward. That's what the markup is for, is to work out the issues. Then, of course, once it's introduced, it gets referred to the committee. And as Erin mentioned earlier, there's a subsequent process after that. Once there's a hearing, though, you can request to testify. You can also suggest witnesses and then submit written testimony as a follow-up, regardless of whether you're asked to testify or not. Next slide. Okay, we're going to just touch base on this real quickly because these kind of flesh out what the different processes steps were. The markup, there's a committee report, there's floor consideration, and at each one of these points, you can work with your member to get good legislative history built. At the committee report, you can draft language or suggest language. You can submit other information to them. And then on the floor consideration, you can ask them to make floor statements, which would support your particular position. Okay, next slide, please. The legislative process doesn't just end there when Congress passes a bill. It has to go to the president to be signed into law. But in the meantime, while we're going through the process, sometimes, as we mentioned earlier, there's the agency view. If the president, the administration has a real problem with the bill, they might send a statement of administrative policy known as a SAP. That's something that you kind of don't want to have, so you need to work with the agency as well to make sure your issues are addressed and that their issues are addressed, and you can come to a good consensus on the bill. Then, of course, the president might issue signing statements as well whenever he signs the bill into law. And that kind of gives you an indication of how the agency might implement the bill. Then, of course, there's post-enactment direction. After the bill is signed into law, the president, he might issue an executive order showing agencies how they need to implement the particular bill. I understand that there was one memorandum issued by the president with some of the COVID relief dollars. So, your work is not done after it gets signed into law. You still need to work with the agency and the White House on how it's going to be implemented. So, next slide. So, advocacy, there's all kinds of key points of contact. You need to outreach first. And second, you need to persuade. And as far as persuasion goes, we're going to look to the experts to discuss that, Brian and Mike today. So next slide. If you have any more questions, please feel free to contact either Erin and I, and look for the slides about 10 to 15 minutes after the panel is over. So Erin, introduce our next panel, please.
Okay, thank you. We are going to head over sorry about that, to Mr. Mike Andrews. Mike is a senior vice president in the Federal Public Affairs Group at McGuire Woods after a successful career on Capitol Hill. He has over 20 years experience in federal Indian law and legislative strategies with a bipartisan results-driven focus. Mike leads McGuire Woods' Native American outreach efforts. In addition, Mike works on agriculture, housing, energy, land use, homeland security, congressional oversight, economic development, and financial services. While working on Capitol Hill, Mike served as staff director and chief counsel for the Senate Committee on Indian Affairs under the leadership of Senators John Barrasso, John Hoeven, and Lisa Murkowski. So I will turn it over to Mike, and I will get your slides up and going.
Thanks, Erin, for that intro. And while you're doing that, it's great to see so many familiar names on this, attending this panel. I'd be remiss if I didn't give a special shout out to Ms. Harjo, who I worked alongside with for many, many years. People don't know, but Rhonda was essentially my office. Can I say the word office wife? She got me out of hot trouble. She got me out of hot water so many times. And I always looked for her steadfast guidance when I was doing things right. And occasionally when I was doing things wrong, she was quick to put me in a timeout, so to speak. But it's great to be with Rhonda and obviously Brian Gunn, who I've obviously had the pleasure of working with when I was staff director and helping Brian and his clients. So anyway, I could go on, but let's talk a little bit about what you probably want to know, and that is how to be successful when you come up to the Hill. You know, for many, it's kind of this arduous campus, a lot of office buildings, a lot of staff. Staff runs the gamut of ages. That's another thing. One of the things that I recall when I first interfaced with Congress many years ago, I came from the executive branch. And I was probably a little bit older. And when I showed up to meet with senior Capitol Hill members, I realized that age doesn't matter. And I remember one of the first meetings I had, I was maybe in my late 20s, and I was dealing with someone fresh out of college and holding a very important title and holding a very important job. And so it took me a little bit of a backseat. And sometimes folks can't get away from that. They think just because they're young, they may not know what they're doing, but I can certainly tell you that young staffer, he or she has the ear of the member. And I learned real quick that treat everybody as a junior member of Congress. And that's where I kind of really want to open up my remarks, is that when you come up to the Hill, you may not meet with a member, and you may be meeting with a staffer. I would just encourage you, and I know many of you know this, as they have the eyes and ears of their boss, and rest assured they will obviously communicate up the chain. So take those meetings with those staffers, extremely important. So let me just start off with that. Anyway, let's get to some of the slides, and I obviously want to leave enough time for Q&A at the end. As Rhonda had mentioned, you need to have a plan when you're interfacing with Congress. We used to take a lot of meetings where we would have members and tribal leaders would come up, and they would want to meet with the member and kind of articulate maybe a concern. And most of the folks were like, "Okay, what's the problem?" And so let me stop for a minute and say, whether it's a authorization, you want a problem fixed, or you want an appropriation. And the nuance with appropriation now are earmarks. And I had just left the Hill, and that's a new, or I should say a returning phenomena on Capitol Hill is that's a specific request for funding for your tribe or for your organization or for your area that you feel deeply about. And so I would say have a specific, measured, approachable problem or solution in hand when you first come up to the Hill. And that will go a long way in terms of your future follow-up, which is also very important, which I'm going to talk to in a minute. So identifying what the ask is, or identifying what the problem is, or the solution, or the ask is very, very important. I cannot preach that more than that. Once you identify that, you need to have a plan of action. Again, next slide. Plan of action, thank you. Finding a baron, which I call them, or a champion for your position. So if your request is, I want more money for diabetes prevention. The special diabetes program is a big ticket item for the Hill. Gets a lot of support, but you'd be surprised that sometimes it falls off the radar. So let's just use that for an example. We want to increase funding for the special diabetes program. Well, you need to continue to find those champions that support that program. Now, chances are you have barons already lined up. The Senate Committee on Indian Affairs, you will find no other members who support Indian country like they do. And as Rhonda knows, it's a very bipartisan committee, something that is a breath of fresh air in the Congress, where our clients are you all. And there's no Democrat or Republican. It's generally what's best for Indian country. Now, we may argue around the fringes. We may have different policy considerations, but generally the goals are always the same, and that is to help Indian people and to support Indian healthcare. In the House, you have the House Natural Resources Committee. You have the subcommittee on Indigenous peoples. So you have built-in barons. But sometimes these barons don't have all the information. And that's where your advocacy and the people you hire to advocate on your behalf are very, very important. So the barons are usually the chair. Start with the leadership, the chair, the vice chair, as it be in the Indian Affairs Committee, or your elected official. If your tribe is in a congressional House district, you'd want to start local. And if you're obviously in the state that has 2 senators, which you all do, then you would want to utilize your senators. But it doesn't stop there. Your senators, for example, let's say the great state of Washington has 2 good senators dealing with Indian country, Senator Murray, Senator Cantwell. Well, they know that they can't do it all by themselves, and they're going to need a partner. They're going to need a Republican partner, as Senator Cantwell and Senator Murray are Democrats. And conversely, if we were in North Dakota, Senator Kramer or Senator Hoeven, they can't do it by themselves, and they're going to need the partnership across the aisle. So to my second point, Democrat and Republicans should be both. And that goes to a bigger concern down the road. What is that road? That road is called unanimous consent. I want you to stop and think about that for a moment. Think about your daily lives. Think about tribal council, for example. For those that have worked in tribal council, like I have, know that sometimes we don't always agree. In the United States Senate, to pass a bill out of the Senate, I need 100, get this, 100 United States senators from all walks of life, for all different political views, spectrums, to agree. Ask yourself tonight when you have dinner with your family, when the family discussion comes up, maybe a football team, maybe politics. Do you always agree? So that's why that part is very, very important. when you have both sides of the aisle covered, when you got those barons on both sides. I'll talk a little bit more about that, how to do that. And then to the bigger issue. What is the message you seek? To identify a problem is one thing. To offer an appropriation is another. But then how do you sell it? How do you come in to the member or the congressional staffer and say, this problem is very important to our tribal community. And if this problem isn't rectified, bad things are going to happen. That's one area of a message. We hear that a lot. The other message that sometimes we hear is, this is working, Congress. We can do more if we have more. And here are the results. Working on Capitol Hill, we love positive reinforcement stories. We like to know what's working. We also like to know what's not working, so we can change course immediately. But that's the type of messaging you should think about when you interface with members. Is what are the outputs?
Are you folding the towel?
Is there somebody on hearing a little back static? If folks could mute themselves, it'd be appreciated. I'll continue. So part of the barons, part of finding allies is tribal organization, National Indian Health Board. Can't think of a finer institution than finding those barons to help maximize support. Other tribal organizations as well that are also in the healthcare industry. Tribal governments. I use Washington State for an example. If the Puyallup tribe and had a problem, they would find similar tribes and maximize their effort across Indian country to advocate that specific issue. Next slide. Next slide. Let's see, the next slide I have is congressional staff. As we're, as if the slide has not changed, I'll continue. Something I mentioned earlier. Yes, congressional staff run the Senate and House. Well, what's important to know is that there's two types of staffers. There's the personal office staff of the Senate and the House member who generally work on specific regional issues. When I worked for Senator Hoeven, for example, on the Indian Affairs Committee, his personal office staff was dealing with the tribes of North Dakota. And then we would supplement that effort on the committee level. Same thing when I worked for Senator Barrasso and Senator Murkowski. But the personal office is usually your first conduit to a relationship with that member. And it's very important. All things are local with elected officials. I cannot stress that enough. And then there's committee staff, like what Rhonda and I were. So we not only served our boss, but all the members on the Senate Committee on Indian Affairs, Democrat or Republican, and then we serve the Senate. And that's a little bit different with committee staff. Our viewpoints are a lot bigger. It's a lot more expansive. So so know that when you're setting up meetings. If I want to meet with the Indian Affairs Committee and I want to talk about a specific issue, you should, and I would say it's a must, that you also include a meeting with your elected senators, staff as well. And sometimes they're on the committee, but most of the time they're not. And so usually the committee staff and then the personal staff will be synced up. I've met a lot of times with tribal leaders who did not have members on the Indian Affairs Committee. You know, the great state of Maine, for example. We would have meetings with tribal leaders from Maine. And then I would, of course, work with Senator King's office, for example, as well, or Senator Collins. And that's kind of how the synergy works on Capitol Hill. We try to be as transparent as possible when we meet with elected tribal officials and with tribal organizations, so we're all on the same page. Congressional staff, as I mentioned, very important. Know that their time is overwhelmed, and that's just the nature of the beast. And it's quite frankly what attracts people to work on Capitol Hill. It is an extremely fast-paced environment, and a lot of them are working many different subjects. The Indian Affairs Committee, and Rhonda knows this, Rhonda worked on public safety. She helped with gaming. She helped with land and trust. She did a lot of the legal review and congressional oversight. And I just threw out 5 that I recall. She probably handled many others. So at any given time, she was pulled in a lot of different directions. And that's with all the members on the Indian Affairs Committee. And I speak for that probably across the board for even the personal office staff. Their time is very limited. But the fact is you're getting a meeting with that member is very important. And quite frankly, it's a positive step in the right direction to help you. As I mentioned, do your homework, identify the problem, and of course, bring a solution to the table. That helps the staff research and work on your behalf. Think about this for a moment. If you just came and said, look, I just want to provide a problem and offer no solution, chances are the staff's still going to do the work. But in terms of prioritizing their time, it's a lot easier to say, I met with this tribe, here's their issue, they would like a fix, and they have proposed language to help fix that problem. And I would say that those tribes, those tribal leaders, and their advocates can get a lot further accomplished by doing that one extra step, providing that solution. Now, I mentioned a lot about staff. Let me just give you an example of the committees, besides the personal office that you would deal with, the other committee staffs that you would possibly have an interface with. Senate Committee on Indian Affairs, the Senate Health, Education, Labor, and Pension, the Help Committee. Yes, sometimes there are cross-jurisdictional issues with Indian health issues that go into the Help Committee. Special diabetes, for example, is one of those. Senate Interior Appropriations. You know, we could have a further PowerPoint presentation on how to deal with appropriations, but that's very important. House Interior Appropriations, House Natural Resources, and the House Labor, Health, Human Services, Education related agencies. So if you think about that, all of those, there's about 8 plus Democrat and Republican, you're dealing about 16 to 20 staff. If you do it effectively to bring your problem or your solution to Capitol Hill. All right, so we deal with congressional staff. Are the slides still stuck?
Yes, I'm sorry, the Zoom froze.
Okay.
So, and
Yes, we're working on getting them back up.
All right.
but in the meantime, we could move on to Brian Gunn,
Okay.
who I believe you are handling your slides.
I am.
Brian Gunn.
Yep, I'm. Oh,
Rhonda, I can actually pull the slides up for Mr.
Okay.
Andrews, or we can move on to Mr. Gunn.
We're on to Mr. Gunn. Aaron, do you have his bio that you can introduce him? Thank you. Are you still froze?
I hope not.
can you see my screen?
Yes.
Okay. Well, I can just go, just in the interest of time. I should probably just go if that works for everybody.
Brian?
Yeah.
Brian is a lawyer from the Piles, Sutter, and Burville law firm. He has been a lobbyist and lawyer for his tribe, the Colville Confederated Tribes, for many years. He has worked on numerous issues in Congress and with agencies, including the Tribal Law and Order Act, the ICE Act, and other different initiatives, big ones and little ones. I have worked with Brian myself for decades, and he is a true warrior for his tribe and the people of Indian country. And I'm very pleased that he's able to join us today. So Brian, please take it away. Thank you.
Yeah, thanks, Rhonda. Thanks so much. Thanks for having me on the panel. It's a real honor to be here. Let me just jump right in. I'm just going to talk about two things. One is to kind of hit on some things that Mike talked about, some strategies and suggestions for Hill meetings, things that at least I've found effective or things that I've seen go wrong that, I could, it's helpful to point out, even though many of them are common sense. But then I want to talk in more depth about a project that I worked on with Rhonda and others on the committee and our delegation office over a number of years, addressing some staffing and facility issues on the Colville Reservation where I'm from. Very quickly, there's just a quick slide that talks about the different offices. Much of this has been covered already. I think what Mike said summed it up best, that, all these folks you meet with have very demanding schedules, that are juggling multiple issues for their bosses. So they're, Fridays are good times to talk with people because that tends to be their downtime, where they have time to actually get to the work that their boss is asking them to do during the week. And the difference in various differences between House, Senate, and committee offices. Just some customs and protocols, things that I found helpful on my end. Doing a one-pager on an issue, getting it to somebody beforehand always works well because they can read, know what the issue is. Reading more than that, I think, is asking a lot of people, given how busy their schedule is. I've seen people hand out 20-page white papers that have footnotes that just never get read. That's probably, I think, part of being prepared. This sounds like it's kind of common sense, but be on time. Especially when you're dealing with offices that aren't used to meeting with Indian tribes, like if you're meeting with people on armed services, ways and means, defense, people that are defense approach, people that don't usually meet with tribal leaders and are used to sort of corporate types parading through, that's not maybe the best word, but kind of a different level, I guess, of being maybe potentially used to a different level of professionalism and people being very punctual on time, limiting meetings to like 20, 25 minutes. I think it's especially important for that. If you've got a big group, just something that I've found over the years, and if you're meeting with a new House member who may have gotten a low draw on the office space pool, and they have an office in the upper floor of Longworth, probably a good idea to get there closer on time than hang around and be very early, because you're dealing with a lot of traffic and people going in and out. So that's just what I found, at least. Mike had mentioned this, both Mike and Rhonda had mentioned this, and I think this is really important. Know what you're going to be asking for. And if you're not going to be asking for something, then tell whoever you're meeting with that you don't have an ask at this time, and you're really just there to explain something. When you do that, that kind of gives them an opportunity to relax and listen to really listen to what you have to say. It's the worst if you don't say what you're asking for clearly, and they're trying to figure out from what you're saying what your ask might be. And then they're kind of in a wondering stage. So I've just found that to be helpful. Don't assume anything. Assume that people, try to lay out the concepts as clear as you can. Again, a lot of common sense stuff. Get in and get out. I found that after having some short introductions, it's good to enumerate what you want to talk about. 1, 2, 3, we're here to talk about this and this and this. Simply because as people with their steno books, that the notes that they keep track of for the meetings that they do, it's easy for them to write those points down and refer to them later when they're trying to, figure out what their to-do list is for that day. And again, brevity is appreciated. I've mentioned this before in different orientations that I've done, but I can't emphasize this enough. You know, if you want to share historical information about your tribe, and it's always very important information, you should probably do that by having handouts that you can leave behind, because what I've seen is especially meetings with large number of attendees, people all go around the room and talk about some historical fact, and then by the time you get to the end, you've got 5 minutes left in the meeting. So I've seen that go good, and I've seen it go bad. But I think brevity, especially with the historical information, is really appreciated. Priorities. This is a big one, I think, just for being effective generally. But I think having some number of priorities like identified is pretty critical to being effective. It helps people kind of associate you with an issue or your tribe or your organization. It helps you focus resources. And I think about Rhonda's former colleague and my colleague of the last 15 years, Paul Moorhead. He said that if everything's a priority, then nothing is. I'm sure somebody else probably said that before him, but I think it's really true. If you go in and if you work for a tribe, and if you hand someone like Rhonda or Mike when they were on the Hill a binder with 20 different tabs that says say here, these are my priorities, you then kind of put that person in the position of trying to figure out what your priorities really are. So having a list, I think, helps. Start with a wish list, winnow it down, I think is good. And persistence is something that I think is key to success. And what I want to talk about just for the next couple of slides is an issue that I kind of worked on, incorporated some of the concepts that I just mentioned in an issue that I worked on for a number of years with Andy Joseph Jr. Badger, who I know many of you know. He's now the chairman of the Colville Tribes. And that's where I'm from too. I'm a tribal member. Colville's a land-based tribe in rural north central Washington. Includes a couple of the poorest counties in the state, fairly rural. Rich in natural resources, but not a lot of economic development there. And Colville's a direct service tribe. And the issue that we had is, and still have, is that if you're a direct service tribe and have never had anything built from the priority list system or a joint venture project, then you are basically operating under staffing ratios that were created or established when your service unit came online. And for us, that was in 1938. So there's really not a way of making the staffing ratios to update them unless you get one of those projects. The appropriations, as IHS appropriations increase, your funding will increase, but the actual ratios of the staff you have doesn't really change. There's not a way of getting a good bump. Portland area has never had a project on the facility construction list. It has one JV project, and that was Warm Springs in 1988 when it was a demonstration project. And for us, it was a real domino effect that was just very severe. One is that the town of Omak, which is my hometown, it's the reservation's largest population center. It never had a permanent health facility, a tribal or Indian health facility of any kind. And what happened was, because we're working out of modular temporary buildings that were never meant to have exam rooms, we didn't have enough space for providers. So not only would we not have a good facility, or really a makeshift facility, but we had, with our space limitations, we didn't have enough encounters, to support. We were losing service revenue, service population numbers, because we were losing encounters and losing revenue. So it was like a bad situation across the board. So what did we do? So I worked on this probably beginning in like 2007. We did a variety of things. When the Healthcare Improvement Act was being up for reauthorization, we worked with other organizations, including the Portland Health Board, on Section 301F, which ended up getting included, which authorized innovative funding approaches for facility construction. We thought, well, if we're not on the priority list, we can at least maybe see if there's another way we can get something built. I worked with Rhonda and Mike and others on a section of the Restoring Accountability in the Indian Health Service Act that provided a staffing demonstration project. It was a deal where I think it's really a good idea, where IHS would provide a short-term infusion of staff, like 3 to 5 years. And once those staff get self-sustaining and start generating revenue, the idea is they become self-sufficient, sort of a way of addressing the staffing ratio issue. And I just did a lot of work with our delegation, especially Senator Cantwell's office. Whenever IHS would come and testify, we always had questions about the staffing issues, about about facilities and various questions throughout the years. So when it came time to apply for a joint venture project, the applications opened in 2010 when we were first in a real need position. We were not able to apply because our sawmills, that was right during the Great Recession, the sawmills were closed. We didn't have any revenue. So we actually weren't able to apply. In 2014, we applied, but we didn't score high enough to get beyond the first round because of some data related issues, but it had to do with the proximity of the project to an existing emergency room. Rhonda, when talking to Rhonda about this dates back to 2014, but she had mentioned to me that Wind River had the similar problem when they applied, but they worked with Barrasso's office and IHS and kind of to better position themselves for the subsequent application. And that's what I did. We basically engaged with IHS, let them know that we're interested. They worked with us on doing a post-mortem on our application. And we just tried to put keep as many bugs in their ears as possible. So when the came time to reapply, the applications open again in September 2019, we felt a lot better. We did our pre-application in 2019 in September. We got a delegation letter supporting the application to IHS. And then we were invited to do a full application in December, and being the only finalist from the Portland area, actually working with Cantwell and Murray's offices, they were able to help get Wyden, and I got some folks from Idaho. So we had an actual Northwest delegation letter to IHS supporting our project. And there's a happy ending. We were informed in May of last year that we were one of 5 projects that was selected out of 34 applicants. But it took a long time, and it took a lot of work, and it took a lot of different ends to get to that point. But I do think the good tip that was about Wind River that Rhonda gave me, and that's really what kind of kept this fire alive, I think, with IHS and their interest. So anyway, I'm happy to answer questions. That's my son Bronson at the Olmec Stampede. He's a powwow dancer. So thanks for having me, Rhonda.
Thank you. We certainly enjoy seeing Bronson and how much he loves dancing. Next, our panelists. Aaron, could you very briefly introduce our next tribal leader panel? I'm certainly pleased and happy to have them join us today.
Yes, I'd first like to introduce Rachel Joseph of the Lone Pine Paiute Shoshone tribe. She is a former chairwoman and vice chairwoman based out of California. Rachel also served as the co-chair of the National Steering Committee on the Reauthorization of the Indian Healthcare Improvement Act and the co-chairwoman of the IHS National Budget Formulation Committee for many years. Rachel was the Secretary, Treasurer, Area Vice President, and Interim Executive Director of the National Congress of American Indians, and included in her service of many years on the board as Chairwoman of the California Indian Legal Services. Rachel is the Secretary and a founder of Women Empowering Women for Indigenous Nations, otherwise known as We Win. So Rachel, if you have any remarks that you would like to start with.
Hi, Rachel, you need to unmute yourself. Yay.
Can you hear me now? Okay. Good afternoon. Thank you to NIHB for the opportunity to engage on an important and necessary institute. Related to engagement, and in the interest of time, because it looks like I have 5 minutes, so I'm going to try to summarize. I do have some handouts which are not yet uploaded. Unfortunately, I'm very old school and challenged technically, so my goal is to have those in the system in the next few days. I do know that the panel is available for a year, and hopefully those are primarily about the reauthorization of the Indian Healthcare Improvement Act and working with tribes across the country. We had 2 tribal representatives from 12 areas, a representative from the self-governance tribes, direct service tribes, and the urban programs. And we established some protocols and guidelines for how we would approach reauthorization. First of all, messaging. The Indian Health Service started off with encouraging, and we all agreed that if we were going to be successful, we needed to talk with one voice. And in the messaging, in fact, I have a bookmark at the top. It says speaking with one voice. I even have my name tag from a 1990 meeting. Actually, it's when I was elected co-chair. And at the top, it says speaking with one voice. So we were committed to do study and build consensus. We also established that we would provide a process for that we would have closed caucus of tribal officials, which was necessary from time to time. I think of an example when somebody challenged the fact that Indian Health Service had staff there as resources, and certainly to provide information and history on a related subject, but there was a feeling by some that they shouldn't be in the room because they were the other guys. It got to be an interesting discussion. We went into tribal caucus. Remember, Julia Davis Wheeler gave a strong prayer invoking guidance, discernment, ability to listen and communication. And we come out of that caucus with a strong commitment that we felt the Indian Health Service was part of a team and they need to be part of the discussion about family issues. So, that's an example how we work together to maintain consensus. So, as a tribe or an organization moves their proposal or budget issue through Congress, they need to ensure that they're all speaking from the same page and have the same message. Sometimes, you could have slippage when people don't agree. And so it's important that we all stay together so that we in fact message together. Just some practical tips, and I think that Brian touched on a part of them because I had on my handouts written and a telephone and meetings. But the importance for written is to be concise and do not flaunt the fact that you're a taxpayer. We need to always be diplomatic. By telephone, we need to emphasize the purpose of the call, and we actually need to prepare ahead of time so that we can emphasize the points that we want to make in the call, and to also, again, as Mike pointed out, the importance of using the opportunity to meet with staff. I feel strongly that congressional staff can give you more time than a legislator, and they in fact are the ones that tend to do the work anyway. The legislator will assign them, so it's good. In meeting person to person with a legislator, Brian mentioned large groups. I personally have a prejudice against huge groups. So many of the legislators' offices are small, and so it's logistically challenging sometimes to fit everybody in. And unless you have planned it carefully, as Brian indicated, you could use a lot of time going on introducing. So if you have a large group of people that want to participate and advocate a position, I would recommend that you consider talking to legislators that don't normally hear from us. I talked with, and I think it was from Kentucky, a staffer from the state of Kentucky, and I walked in to talk about the reauthorization of the Indian Healthcare Improvement Act. And he said, we never hear from you. And it was a very interesting discussion because he's very interested in what we were about and what our needs were. And so when we have large groups of people, I would recommend that we take advantage of our limited resources and target other people in addition to those we usually talk to, those that are our friends and those that we spend a lot of time with. I think that would be advantageous to Indian country. Legislators often hear conflicting positions and from their constituents. So we should not expect they're always going to vote our way or feel insulted if they don't always represent our viewpoint. However, it is important that we win the big ones. And I think that that's important that we work on that. When we meet with them and we assess that we don't know where their position is, we need to offer them the opportunity to meet with them, to talk about it further, ask them what additional information they need. And then we need to follow up and provide them information that we feel that they need to help them come to a conclusion or come closer to our position. We should ensure that our advocacy is effective and that we prepare and that we stay together, and that when we have an advocacy position that we're asserting, that we stay together. And just as an example, at the very end of the reauthorization, we were asserting that we needed to be made permanent. It's very expensive to go through years and years of advocacy. And we had a region that actually didn't agree with that, because we said we need to come back to Congress and educate them, and they have a trust responsibility. And so they actually objected to permanent reauthorization. So I spent some time on the phone working with tribal leaders from that region that had participated in the consultation originally and were on the National Steering Committee originally, and said, what's going on and you need to help. But we had to work to ensure that we ended the process speaking with one voice. And we in fact did that. And I would strongly encourage tribes and organizations and intertribal organizations to develop your advocacy strategy to ensure that people stay together on our important issues. Thank you for the time.
Sorry, that was great, Rachel. All these years working together and working with people like Brian and Mike has certainly built up a wonderful portfolio of Indian victories over the years. We were scheduled to have Nick Lewis, who was the vice chairman of the National Indian Health Board and council member from the Lummi Nation, but he has been involved in the VA listening session, and along with Chairman William Smith, who is also a veteran, we're engaged in a very spirited discussion with the VA folks. And so we're hopeful that they're going to continue championing for Indian health and our Native veterans. And he was going to handle all of the virtual engagement. So unfortunately, he's not able to break away yet. So we do want to thank everybody that has participated today. And if there's any questions, please feel free to put them in the chat. I do have one question though. And, you know, if you guys watched that movie Aquaman, you heard them discuss about Atlantis has always had a king, but now it needs something more. And Aquaman says, well, what's greater than a king? And his mom says, a hero. And so Indian country has always had friends, but now Indian country needs something more. Indian country needs a hero. Indian country needs a champion. And you heard that today. So I just kind of wanted to, in the last minute or so of this panel, ask our esteemed panelists, how do you develop, build, find a champion? Rachel, you want to take it away first?
I unmuted? Okay.
Yes, okay.
First of all, I think it's important that our champions know us and care about us. And sometimes that takes the process of reaching out and educating them and giving them opportunities to learn about us. Way back 1,000 years ago, when I worked for Governor Brown on his staff, we had a meeting of the statewide Indian organizations, and we had actually became my favorite senator, came to us and said, there are 3 things that are important to a legislator: money, votes, and good information. So I think our legislators to come to community events, that gives them the opportunity to be exposed to potential voters, but also to learn about us. So I think that it's important that we try to make friends, because you know how friends and families are. They stand with you and they stand by you.
Brian?
I couldn't have said it better. I mean, you know, the community events, having people like I always try. I'm from OMAC, as I mentioned. We have this event called the OMAC Stampede, the second weekend in August that folks from Washington know about. I always try to have every year that's a non-pandemic year, have people come out who work in different Hill offices so they can kind of see the horse race, see the rodeo, you know, just hang out with us and folks and tribal leaders for the weekend. So they kind of like feel like they're connected to the community. And you know, I think doing that, we've gotten some champions on issues that we wouldn't have, or heroes rather, that wouldn't necessarily have a reason to be engaged on Indian issues. So I agree with Rachel, just getting people to community events, getting them to see and hang out with people and have a good time, really, and just be comfortable. It gives them a good feeling and it makes them want to work with you.
Thank you. Mike?
As we like to say, I like to associate my comments with both Rachel and Brian. I think they were spot on in terms of getting engagement. The one thing I would just remind, I think Rachel mentioned a little bit, is this modern day Indian country, 2021. If you look at a map, 40% of the Congress does not have federally recognized tribes. Which means is, yeah, you probably want to knock on the door to members who don't have tribes and introduce your culture to them and let them know that, you know, it's one United States and you may not have a federally recognized tribe, but your issue is still very important to your community. And it helps staff as well, because constantly, one thing I didn't talk about is the education that the committee work and the personal office does on behalf of tribes, which is very important. And so the more advocacy that you all can do to members who don't have tribes will go a long way in achieving a positive outcome for your issue.
Okay, unity, education, and relationships. Those form the basis of what we can do to find a hero, find a champion for Indian country. This wraps up our time on the panel. I want to thank everybody for joining us today. I know we ran long a little bit, but certainly this information is so critical. I think every piece of it. And so we didn't want to shortchange anybody. And just remember, the panel PowerPoints will be up on the website shortly. And then you can see everything that Mike was going to say before it froze. And I'm sorry about that, Mike. I know you put a lot of work into it. So thank you for everything. Thank you for all that you guys do for Indian country and for everybody for sticking with us today. With that, we are adjourned for today. Thank you.